Do you struggle with dark patches that just won't fade no matter what you try? If so, you might be dealing with melasma. Hi everyone, I'm Dr. Aleksandra Brown. I'm a board-certified dermatologist and welcome back to my channel, or if this is your first time here, welcome to my channel. Today I'll be walking you through everything you need to know from understanding its causes to finding the best treatments to help you manage your melasma. So if you're ready to learn how to tackle melasma, keep watching, and don't forget to like and subscribe if you find this video helpful. Melasma is a chronic condition that leads to formation of dark, uneven patches. These are typically found in sun-exposed areas, most commonly on areas like face, neck, and shoulders. It is most commonly seen as brown to gray-brown patches on cheeks, forehead, bridge of the nose, chin, and sometimes even upper lip. Unlike the smaller dark spots that you may get from acne or skin irritation or sun damage, melasma often tends to cover larger areas, making it much more challenging to manage. It can be distinguished from regular sunspots in the sense that sunspots are typically just individual round spots, whereas melasma is more of patches in particular distribution. Most common distribution areas are forehead and cheeks, upper lip, and sometimes even the lower jawline. The exact cause is complex, but it's usually linked to an overproduction of melanin, which is the pigment responsible for the skin color, and it can be triggered by various internal but also external factors. But here are some of the main contributors to melasma. Number one is sun exposure. UVAs can trigger excess melanin production, worsening melasma. That's why melasma often intensifies in the summer and improves in the winter. Even short exposure, just running errands or going to a mailbox, can stimulate more pigment production, worsening the melasma appearance over time. This is precisely what wearing SPF every morning is crucial as a step one for treatment of melasma. Next thing that makes melasma worse are things like hormones. Hormonal changes such as those from pregnancy or birth control pills can lead to melasma. This is why sometimes melasma is referred to as mask of pregnancy. Heat is a next trigger factor. Even more than regular sun exposure, heat can worsen melasma, which includes not only outdoor temperatures, but also heat from things like kitchen or hot yoga sessions. Genetics is another thing that contributes to formation of melasma. If you have family members with melasma, this increases your likelihood of developing it as well. So now that we've talked about all the things that can contribute to it, you might be worried there's so much I can't control. And that's kind of the case. So here's some of the tips you can do to prevent melasma from happening. Because it's so often triggered by factors outside of your control, like hormones and genetics, it may not be possible to prevent it entirely. However, there's some key steps you can do to help minimize the appearance of it, as well as avoid making it worse. Step one is using sunscreen every single day. Any sunscreen is fine, however, tinted sunscreens with iron oxides are especially effective as it offers better protection against UVA and visible light than your traditional chemical or mineral sunscreens. Some of the product recommendations in this one, I have so many. I have melasma myself and I have tried many tinted sunscreens and I love a lot of them, and I'll be honest, I often mix them up, as in not mixed together, but I'll use a different one on a different day depending which one I find more hydrating or more mattifying depending on the time of the year. One of my top recommendations in the tinted mineral sunscreen category by far is the ISDIN Eryfotona Ageless Ultra Light Tinted Mineral Sunscreen SPF 50. This one is really lightweight. It's a little bit on the darker side. If you're really light skin type, this might not be your jam. Some of the other ones in this category that I really liked are INNBEAUTY Project Tinted Mineral Sunscreen, as well as Bliss Mineral Tinted Sunscreen. Next step at minimizing melasma is limiting your heat exposure. Heat can worsen melasma by stimulating melanin production, so try to avoid high heat environments such as saunas or intense sun exposure. And yes, this means even if you're at the beach or at the pool with your tinted mineral sunscreen on and a hat on, sitting under the umbrella, yes, your melasma can still get worse even if you're not in the direct sun. Now, let's say you're doing all of this and your melasma is still getting worse. What are some of the treatment options that you can use, especially over the counter, that you can get your hands on and keep that melasma at bay? I'm going to go over some dermatologist-approved options that can help fade your melasma. I have tried many of these and a lot of them work pretty good. I'm going to start by saying that prescription topicals will work quite a bit better, in my opinion, in my experience, personally and with my patients. However, I understand that a lot of you may not have access to a dermatologist or may be interested in more budget-friendly options, so stick around, we're going to go over those next. So why is melasma so challenging to treat? Unlike regular dark spots, melasma is influenced by both internal factors such as hormones, but also external factors such as sunlight and heat, and that makes it particularly stubborn to treat. This is why traditional treatments for hyperpigmentation, like lasers alone, may not be as effective for melasma. Additionally, this is not something that we get rid of or cure, rather it's something that we manage, and this is because of those internal trigger factors. It is extremely important for you to understand that melasma is a chronic, ongoing condition that we manage, and we can manage it very effectively, but we certainly cannot cure it. So here are some topical treatment options. Step 1, and this is after the sunscreen, particularly after the tinted mineral sunscreen, which is a must every single day. Your step 1 is going to be retinoids. Retinoids work by boosting cell turnover. They help fade existing pigmentation and prevent melasma patches from forming. For beginners, I would start with like a lower concentration to minimize irritation and then gradually build up. If you are pro at using retinols and have a physician or dermatologist, ask for a tretinoin prescription. If you're experiencing irritation with your tretinoin or the retinol over the counter, try the sandwich method by applying a layer of moisturizer first, followed by your tretinoin, followed by moisturizer again. I'm going to go ahead and link up my retinol irritation video here, so if this is something that you're interested in, if you're developing irritation, check it out. It's very helpful. Next step after retinols is going to be with bleaching creams. Bleaching creams, particularly those that are prescription strength, such as hydroquinone, can lighten melasma by reducing melanin production. Now, if you can't access a dermatologist, there's an over-the-counter options that are worth trying. First one is azelaic acid. Azelaic acid is known for reducing melanin production and calming inflammation. It is a gentle option for sensitive skin types. My top product recommendation in the azelaic acid category is probably the 10% azelaic acid from The Ordinary. It is very budget-friendly formula. It helps lighten pigmentation and improve skin texture without any irritation. My next, and this one's very popular, is tranexamic acid. It works by inhibiting pigmentation pathways in the skin, providing an effective approach for reducing melasma when used with other brightening agents. A lot of these are best when used in combination with other agents, so you may want to consider alternating them rather than layering them together. Therefore, you minimize the irritation. Tranexamic acid product recommendations are things like SkinCeuticals Discoloration Defense. This powerhouse serum blends tranexamic acid with niacinamide and kojic acid to improve skin clarity. Another great option here is Naturium Tranexamic Topical Acid 5%, also contains kojic acid, niacinamide, and licorice root. Worth mentioning here is an option that is prescription, and in my opinion, this is the most effective, and that is the oral tranexamic acid. It can reduce melanin production from the inside out, and it's often used during peak sun exposure seasons like summer to keep melasma at bay. This is only available by prescription, but it's something that has completely changed how I approach melasma and has been life-changing for so many of my patients. My patients will often take this on a daily basis in the summer months, but in the fall and winter months, they may take it every other day or even stop completely. Next, and really important step in managing melasma is vitamin C. It is an antioxidant and it protects against environmental damage and lightens pigmentation by inhibiting melanin production. Its brightening effects can help improve the appearance of melasma, and some of the really good recommendations in this category are things like VG Lift Active Vitamin C Brightening Skin Corrector. This serum has vitamin C and hyaluronic acid, and together they help brighten the skin and enhance hydration. Another favorite here is also Prequel's Lucent-C, one of my favorites. I've probably gone through about 2 bottles of this year. Next thing to consider when treating your melasma are things like niacinamide and vitamin B3 based treatments. Niacinamide offers anti-inflammatory and brightening benefits. It reduces melasma's visibility while soothing the skin. My favorite product recommendation here is definitely the Roche-Posay Mela B3 Dark Spot Serum with the Mela and niacinamide. This targets dark spots while providing hydration, and just like all our Roche-Posay serums, it's very gentle and hydrating. It is suitable for sensitive skin and helps to reduce discoloration and balance skin tone. I also wanted to mention that Roche-Posay also has a sunscreen, Mela B3 UV Daily SPF 30, which is really good for melasma patients and contains their famous thermal spring water, niacinamide, and SPF in addition to the Mela B3. So it's one of those where you can get all in one. And nowadays, I don't think we can talk about melasma and not mention the so famous and trendy and TikTok viral turmeric kojic acid cleansing pads. I have seen several videos of this and looked into turmeric, and I do think turmeric and kojic acid are excellent ingredients in treating melasma. However, I don't know that turmeric and kojic acid are as good as they're hyped up to be on TikTok. If you're using all the other products and you're looking for a cleanser option that has some brightening ingredients, the turmeric kojic acid pads are certainly a good option. Just make sure you're really careful with them, as there is an exfoliating side that can irritate the skin. The reason turmeric is often not found as a leave-on preparation in these topical treatments is because it can be very staining to the skin. but as a cleanser option, it may be beneficial in addition to the other treatments. Next up are chemical peels. These can be especially helpful when paired with other topical treatments, but they should be done sparingly to avoid any irritation, as irritation and heat to skin can cause melasma to worsen. It's important to understand here that it will not be a single chemical peel that gets rid of melasma. I often see patients who have not been using any topicals come into the office under the impression that this one single chemical peel is going to remove all their melasma forever and ever, and the truth is that chemical peels make a great addition to topical skincare regimen, but alone they're just not going to get it done, and they're not going to keep your melasma away. And even though they may improve your melasma slightly or even significantly, let's say, without the topical skincare regimen to maintain those results, you're really throwing your money away. Lasers are another option, and while lasers can be effective for some forms of pigmentation, they come with a word of caution. The heat generated during those treatments may actually worsen melasma in some individuals. Specifically, I'm talking about IPL and BBL, or broadband light here. That's why it's essential to work with a board-certified dermatologist who can assess your pigmentation and determine whether you have brown spots and might be a good candidate for IBL and BBL, or if these laser treatments are not appropriate for you because you have melasma, which can be worsened by sun. That's why it's so essential to work with a board-certified dermatologist who can assess whether laser treatments are right for your specific case. For example, I've seen many patients in my clinic who've had IPL or BBL done on their melasma just for it to come back even worse 2 to 3 months later. These devices produce way too much heat to be successfully used in long-term treatment for melasma. In general, I recommend a good topical skincare regimen with maybe occasional chemical peel at the end of the summer, possibly an oral tranexamic acid if you're a good candidate for one. Make sure you discuss all of these options with your dermatologist prior to starting your regimen. Make sure you have a plan. Which prescription medication are you going to use what time of the year, in addition to what is your maintenance therapy for your melasma year-round, as well as which chemical peels you might be interested in the winter months. That is all I have for you today. Remember, with melasma, consistency is the key. Patience is essential. Melasma treatments can take a long time to see results, and it comes back so easy, so don't skip that sunscreen, not a single day. If you found this video helpful, don't forget to like, subscribe for more skincare and skin health content. You can also find me on Instagram and TikTok at Dr. Aleksandra Brown. It's Dr. Aleks, no X. Thanks for watching. I'll see you next time.